Okay, so my PowerPoint is based on navigating healthcare and basically empowering patient wellness. So, like I said, the main barrier right now is the system that healthcare is in. It's with the insurance policies, the transparency of the hospital within the bills, and also just the assistance that they can get. It's with the resources available and navigating through those resources, finding out what works, what doesn't work, and just kind of starting point, which I feel like a lot of patient families don't have. So that's the barrier we're focusing on. So our mission is to restore that peace of mind. Essentially, it's to help with that financial anxiety. Just having that start point and having someone that can walk you through the whole process, is going to be very beneficial. Someone you can interact with and say, "Oh, I tried calling this person and it didn't work. What can I do next?" And I think that back and forth can help extremely with financial anxiety because you have someone that's giving you the sense of stability and is helping you navigate through a tough time. So that's why we built this solution. So for this solution, it's an AI-powered financial navigation. The first part is there is a intelligent chatbot you can just ask questions to. So this could be like just regular financial terms or even hospital jargon. For example, maybe just an example like, oh, what is a medical bill? And it will respond, oh, what a medical bill is. Or if you're trying to find specific doctors, it will help you find those specific doctors within a hospital. Like give me a list of heart surgeons. And then the other part is it creates like an actual priority list from top 10. So it will like have the top first choice and it will be like, okay, this is how much you can save. Try contacting this. The second choice you can do is this. So just a list of 10 options you can potentially do. So the user will put in their constraints, their medical debt, their salary, any demographics, location based to find local grants, blood type if that's necessary, treatment, how much they stayed, how long, and all of that information. And then the AI will create this list for them to approach with. So the whole idea of this app is to help create the sustainability and honestly stability, just assessing or giving patients that access to providers, patients, and other resources that are out there that they may not know of. So yeah, that's why we started this whole patient access thing. It's really to help them through the healthcare system, which is the primary goal, and looking through the bills and finding a solution that works for them and their family, because each situation is unique. Each financial situation is different. But yeah, um, that's it. Do you want me to go over the demonstration?
Yeah, let's do the demonstration also.
Okay, perfect. So this is the app. It's called MediNavigator AI. So the first you can do is you can press start analysis. So what we have is a patient profile. So this will ask stuff like their name, their birth date, their age, blood type, their height, their weight, insurance, location, medical history. And the reason we have a patient profile is so the patient has all of this information already saved that the chatbot can reference. And with the as well as the patient profile, we have the start financial analysis. This is more of like if you're checking for a friend or someone. So in case you want to just have like a quick one-time thing and you don't want it to be saved to your account. So for now, I have this information patient profile. I'll just put like 165, 54, and Blue Cross, and like 45,000. And you can further go and fill all of this in if you want. You can also add an emergency contact, and I'll just press save profile, and then I'm going to run AI analysis. Okay, so I didn't put anything specifically right now, but it will summarize your situation and it will tell you how much you can potentially save. So we have three tiers. One is red, which means you're not going to save that much. Next is this yellow, which will be like, okay, you can save up to 20 to 50%. So they have an estimate. And then green is you can save a lot more. So it will create this action plan. It will tell you contact the billing department. I didn't list a hospital, but it will tell you a hospital. And then you can see billing statement and it will tell you what you can say, what they can do, and then also why this step is important and how much you're expected to save. Then it will be like, okay, insurance, add Blue Cross. And it will tell you how much you can save, what you can say, and it just keeps going. It also has this, which says this is insurance, this is government help, this is a nonprofit. It also lists the number and email, and also website, nonprofit, and then if you scroll down, there's 10, and then this says credit union. So and then there's a chat bot to the side, and let's say like I'm like, oh, I'm super stressed, like I don't know what to do. It will give you a response. And then if I'm like, I tried calling the hospital, no one responded. It will give you a list of when you can try calling them again, timing in case you didn't call at a good, appropriate time, and so on. So that's the AI navigator with that, and that comes under analysis. Patient information is the profile that I was talking about. Next is resources. So here it's like if you want just general resources. So if I say like NJ, cancer, and I make 35,000, I can say find resources near me, and then it will give me a list of resources, as well as number, website. So this is everything. If I want to go only government, I can find these government resources, nonprofit, hospital, and then any legal. So that's how that works. And then the very last thing is this AI chat. This is what I was talking about, just very general questions. So I could be like, what is a medical bill? And it will tell me. If I say, can you list a few doctors at John Hopkins, it will give you a list of doctors. So that's how that works. Just very general, like one-to-one. It's like a chat GPT, but for the medical side, and the niche of that with insurance, treatments, appeal letters. Can you try tracking an email or for something general? And it will ask you questions like I would like to know, and then all of that. But yeah, that's for the demonstration part. Do you have any questions?